Hi, I'm Dr. Aaron Bates, your Ventura County Spine Authority, and today we're going to go over what you need to do if you have a back injury. First of all, two things not to do. One, don't freak out. Everything's going to be all right. One thing you need to know with all acute back injuries is 60% of them will heal on their own. Probably number two, the worst thing you can do though, is start talking to a friend who has also had a back injury and asking them what they should do, because what they did that helped them might have been relevant to their specific problem, but could be absolutely detrimental to you. Okay, so the first thing that you really need to do, honestly, is go see your healthcare provider. Now, a lot of people go to their general physician first. Some will go see their spinal specialist first. And the idea behind that, though, in seeing your general physician is you have maybe a better relationship with them, you know them. The downside is they have very little training in spinal rehabilitation or even diagnosing the specific problem, whereas your spinal specialist, your chiropractor, will be a much better person to diagnose the problem as well as treat the problem if treatment is needed. So the first action step, unfortunately, is not some silver bullet that's going to get you rid of back pain immediately, because every back problem is totally different, even if the pain of different individuals is similar. So please keep that in mind. Now, when you go to your general physician, a lot of times they'll give you some type of anti-inflammatory, pain medication, and muscle relaxers, which can give you some relief. But remember, even though 60% of back problems can heal, the most common cause to all back pain is the reoccurrence of an old injury. So a lot of the actions of a medical doctor doing what I call prescribing a pill and praying, because typically that's actually going to get you improvement 60% of the time, can lead to some chronic problems. So it's always important to address these issues head on. Now, the reason why we came up with this video was because we actually had a very specific case come in this week who went to their general physician first and was given the trifecta: painkillers, muscle relaxers, and anti-inflammatories, only to have his problem get worse over the next 10 days, which can happen in 40% of the situations. And in this case, what we did was we did a proper diagnostic on him, proper analysis and examination, neurological assessment, so that we could first diagnose, and here's what we found. So our patient who had severe back pain and leg pain, through the exam, we found palpation, the problem specifically in his L5-S1 vertebrae, and through our neurological assessment, we found nerve pressure and weakness leading to the S1 myotome, which is consistent. It means this area of his spine is putting pressure on his nervous system. But through the x-ray, we learned also that our patient actually has a major back problem. And I'm gonna show you that right now. So what I've done is I've outlined the bones of the lumbar spine in red. And we just did the L3 because we don't need to see anything else. But L3 and L4, they have good positioning relative to each other. They're lined up right next to each other. There's good disc spacing, good spaces for the nerves to exit the spine. L4, L5, again, good alignment relative to each other, relatively good disc spacing. However, when we draw a line along L3, L4, and L5, we're going to see a break in that line at S1. This is a sacrum. And what's happened here is this vertebrae has actually translated forward almost a full centimeter, which is substantial. And this has a really fancy term called a spondylolisthesis. And we never would have found this. We found the problem, but never would have properly diagnosed without the imaging. This is a quite serious problem where somebody went to their medical doctor and they said, take these painkillers and rest, which could help with pain, but in the long term could create some significant problems for this patient. So in summary, should you have a back injury, always remember, first, don't freak out. 60% of these problems are going to heal on their own. Second, don't always take the recommendation of a friend. Every back problem is unique, even though the symptoms can be very similar. And lastly, the action step you should do is always get a gold standard analysis. You can get the gold standard analysis from the doctor who specializes in that area of conflict or that health problem, which in this case is your Ventura County Spine Authority, your chiropractor. Always get gold assessment through neurological assessment, spinal assessment, and as well as x-ray. I hope you enjoyed this video. If you did like it, please give us a thumbs up. If you have any questions, we do respond to questions on this video, so enjoy.